It's Your Case, presented by vetct.com. I am Olga Travetti, your radiologist on demand for this week. Today's example is a 4-year-old male rabbit with a 3 weeks history of ptyalism and oral pain, which are partially responsive to gabapentin. Okay, we start evaluating the teeth of this rabbit from the transverse bone algorithm. And we can immediately notice that the occlusal surface of some of the cheek teeth, instead of being horizontal as expected, as this one for example, which is pretty normal, is oblique. So when you see something like this, it means that there is a mild degree of malocclusion, and this is more prominent on the right side in this case. Regarding instead the reserved crowns, we have generated a multiplanar reconstruction in maximal intensity projection, and as we did the last time, draw a line between the tip of the nasal bone and the occipital protuberance. And in this case we are on the right side, as we can see from the reference lines. There is a couple of reserved crowns which are minimally extending minimally dorsal to the reference line. So on the right side there is a very mild overgrowth, and on the left side similarly there is one for sure, and the second one probably slightly overgrowth respect to the normal. So now we proceed to assess the main problem of this rabbit, which involves the 5th and 4th left mandibular cheek teeth. So first of all, we can notice that the 5th mandibular cheek tooth is smaller than expected, so there has been some resorption. This is a long-standing problem, and the tooth is deviated, so it's not straight but it's distorted, and it is deviated medially. And the reserved crown of this tooth ends at this level, so it ends medially, it's curved medially. The mandibular bone at this level is expanded and is osteolytic. The soft tissue algorithm shows us that there is hypertenuating material surrounding this reserved crown and a rim of peripheral contraseptaic. When we move more rostrally to assess the 4th, it's a bit the opposite. So the tooth has a normal shape, but the reserved crown again has a abnormal orientation, and in this case is oriented laterally. And similarly, we have osteolysis of the mandibular bone at this level, especially if we compare with the contralateral, we can see the difference. And again, the soft tissue algorithm shows us that there is hypertenuating material and there is a rim of contraseptaic at this level. So this represents a infection, so an osteomyelitis of the mandibular bone at 2 levels. So we have 2 abscesses, organulomas, that involve the mandible, and this can definitely explain the pain that the rabbit has. Also, we have to remember that the trigeminal nerve runs at this level, so it is possible that the trigeminal irritation from this process, or even some impingement of the nerve, can cause some degree of oral pain in this rabbit. And when we look at the rest of the CT, particularly the nasal cavities, we can see that on the left side the nasal turbinates are actually partially interrupted, and that there is rostrally a mineralized structure with some hypertenuating soft tissue material in ventral position. And more caudally, but this is more difficult to see, there is a very thin linear tract going from lateral to medial and from ventral to dorsal. On a 3D reconstruction, it looks like something like this. So this is probably a very thin linear foreign body, and the mineralized structure we saw rostrally could be a mineralized granuloma, for another foreign body, or a dystrophic mineralization. But the bottom line is that there is a foreign body and the foreign body rhinitis in this rabbit, which is debatably important for the clinical history we have been provided with, but it's important to report on because it may prompt some further therapeutic steps. So I hope you enjoyed this case. Be sure to review the full report associated with this case. Thanks a lot for listening, and remember, it's your case, so please post your questions on social media.